Hello, my name is Patty Braun, and I am a medical provider in a federally qualified health center. We are talking about oral health during pregnancy. The U.S. Surgeon General, the World Health Organization, and the American College of Obstetricians and Gynecologists, or ACOG, all state that oral health is an integral part of preventive health care for pregnant people. ACOG recommends that prenatal care providers assess oral health at the first prenatal visit. The Health Resources and Services Administration, or HRSA, has specific oral health clinical competencies of all primary care providers. These 5 core clinical competencies are risk assessment, oral evaluation, preventive interventions, communication and education, and interprofessional collaboration. Let's see an example of how the clinical competencies can be part of a prenatal visit.
We've been talking about different ways to stay healthy during your pregnancy, including healthy foods and drinks. Taking care of your teeth and gums are also connected to having a healthy pregnancy and baby. May I ask you some questions about that?
Sure, ask away.
Good. So how are your teeth and gums doing right now?
I've noticed that when I brush, my gums bleed a little bit more. And I do have one tooth that's really sensitive to hot and cold foods.
Okay, good. Thank you for letting me know. Pregnancy hormones tend to cause your gums to be swollen and inflamed, and that could be why your gums are bleeding. So brushing, flossing, and getting regular dental cleanings are all important at this time. Can I examine your mouth?
Sure.
Great. Let me just get my gloves on and we'll take a look and make sure everything looks okay in there, and I'll let you know if I find anything. I am looking to see if there are any white spots on your teeth, which are beginnings of cavities. Any brown spots means the cavity is already there, and also if your gums are swollen. All right.
Does everything look okay?
I see something that is possible a cavity that I would like a dentist to take a look at. Okay. Do you have a regular dentist who you go to?
I used to, but when we moved here a year ago, I just never got around to finding one.
Oh, okay, I understand. So when was the last time you saw a dentist?
Maybe 2 years ago.
Oh, okay. So let's do this. How about I send a referral over to the dentist located in our dental clinic? Since I don't like the look of that tooth that is bothering you, I would really like you to get in as soon as you can. What do you think about that?
Are you allowed to go to the dentist when you're pregnant? I thought the x-rays weren't good for the baby.
I understand your concern about your baby, and I get it, but dental care and x-rays are all recommended during your pregnancy, and they are safe. Getting your cleanings, your x-rays, the local anesthetic, which is the numbing medicine that we use, are all safe during pregnancy. So if you need any dental work done now, it's really important that you get them taken care of, because the bacteria that causes cavities in your mouth can actually be passed to the baby.
Good to know. I'm usually really good about brushing. Just with the nausea, I haven't been as good lately, but I think the nausea is getting better now, thankfully.
It's great that you care about your oral health and that it's part of your normal routine. Nausea is rough, but I'm glad that you are feeling better. Are you vomiting at all?
No, luckily. I find that if I snack on something almost constantly, I feel better.
I'm glad that you found a strategy that works for you. Eating frequently does help with the nausea, but some snacks aren't great for your teeth or a healthy pregnancy. What ideas do you have for snacks that might help with both?
The nurse said that I needed to have more protein in my diet, so she suggested things like hummus, nuts, cheese, that sort of thing.
Absolutely, and those are all great for your teeth too. Also, drinking plenty of water in between the snacks, the meals, are all important. I see that you live in Denver. The tap water in Denver has fluoride in it, which is really good for your teeth. And also make sure that you have fluoride in your toothpaste.
I think my toothpaste has fluoride in it, but I will double check.
Good. So let's go back to seeing the dentist. I will send a referral over to the dentist in our dental clinic. They should have all of your information and they can give you a call. But you are also welcome to give them a call at this number and schedule that appointment.
Perfect. I can do that.
I know we have talked about a bunch of different things to do during your pregnancy, but what do you personally feel like is important to do next about your oral health?
Well, I know that I need to get into the dentist to look at the tooth that you saw, but I'd also like to work on eating healthier snacks. Now that my nausea is better, I should probably get away from just eating cookies and crackers all day.
That's a great plan. You take care, and I will see you next time.
Thanks, Dr. Matias.
For more information on the role of prenatal care providers in addressing oral health in collaboration with dental teams, please consult the National Consensus Guidelines found at mchoralhealth.org. Thank you to HRSA for funding this work. For more information, visit cuelearning.org with the registration code of oral health.